I'm going to talk about COVID communication and translation, and you're probably sick to death of it. But as you will recall, memes like this circulated through the press and through all media, telling Australians about bad translations, in this case, a mix-up of languages. And then we had articles like this in the press. This was probably the most that Australians ever heard about translation and interpreting. We were frontline news. Not all of it good, unfortunately. The SBS did try to balance things out, making translators and interpreters frontline heroes, but the memes that gained most prominence, I suggest, were overwhelmingly negative. What happened? Well, that's a big story. I'm not going to do that. I just want to talk about the problem of relations between translators and what we might call community-based mediation. All right. And I beg forgiveness for overstating the case. I mean, translation and interpreting involve many, many kinds of communication. Why am I focusing on this one? Well, because it was a frontline perceived problem in the press, and the role of the press interests me very much. Also, translation practice did change. I think there was a shift from reliance on NATI certified translators and interpreters to community-based mediation. Rachel McCready will tell you more about that. And it's an interesting question. Practices changed or were added to, let's say, did the policy change? And that's what Rachel will be talking about. For an academic, this is a case study where there's lots of data available and lots of analyses by various people, not just me or the team that I've been working with, but all over the place. We have lots and lots of information. Great. And the vaccination phase of that communication was of particular interest because vaccination requires almost universal coverage, okay, a very, very high percentage in order to work. So if you have 260 plus languages, like in Melbourne, you have to work into a lot of languages. And vaccination only works when it's trusted, where the messaging is trusted, because all vaccines are voluntary. Since vaccines do kill people, don't tell anybody. Okay. And then the problematic of behavior change communication connects with other instances that are of importance. We just have floods in the north of Victoria now. What happened? Shepparton, it's an area for refugee asylum seeker relocation. Well, sounds bad, doesn't it? 10% of the population are recent immigrants. Translation and interpreting services were terribly absent, and the fallback position was on the community's own resources. So the same thing that happened in COVID is happening right now as I speak in the north of Victoria. It's a similar problem, but even more extreme for climate change, where the risks are much greater, although the urgency, I suggest, is indeed similar. Climate change communication, behavior change communication. Put all these together, and this is a bunch of problems where researchers might be able to help. Who knows? Let's see. We've done some research. January 2022, here's the team, not led by me, led by John Hadjic. And it's a interview-based study of various communities in Melbourne, basically. And I'll just summarize the finding. I'll summarize what they said about translations, actually, because that's what interests me. The way the people in these community organizations, the cult community organizations, talk about translations. One other thing that's not here is the difficulty of finding the translations, but here I'm focusing on the translations themselves, okay? There was widespread perception in these communities of a gap because the translations were not happening fast enough. They were getting out of date. One news story reported a translation arriving 8 weeks late. In COVID, 8 weeks, that's another variant of COVID and another two lockdown policies, I think, depending on the time. A big stress point was that the translations done by the communities were more trusted because they were closer to the communities, and someone they trusted, okay, information would be confusing, so they're editing it out to also make it easy to understand for the community. So it's not a straightforward translation that's going on. It's a process of translanguaging is another word that's used there. Or shall we say adaptation and translation, mediation in general. Winning trust is something that's stressed over and over in these accounts. The fact that people like community leaders, church leaders in some communities are very close, people are trusted, and trust comes from doctors with the same background, etc. So the idea of trust that we find here is overwhelmingly what one would call thick trust, where the multiple relations that a person has with the community build up their trustworthiness, as opposed to thin trust, which would be NATI accreditation, a professional qualification. I'm the professional translator. That's the only thing we know about you. That's thin trust. Here, they're talking a lot about thick trust in that sense. The community spokespeople, in this case, were rather critical of translations, particularly with respect to terminology, literal translation, word for word, and then the bottom one you can see there is a case of cognate languages that overlap a lot. And it's very difficult to get it right about what kind of language you would use for what kind of messaging. Very subtle distinctions that are presumably done better or claimed to have been done better closer to the communities concerned. General problem of register, because the texts were written in English as public messaging of a medical nature. At the beginning, that it did change for some messaging. And a lot of the work that the people in the communities report doing is making it easier to understand. Okay, simplifying things, getting rid of some of the formalities that were not appropriate to the register, and so on. I'm not going to insist there. Everything we found there is fairly well known and repeated, not just in the studies done in Australia, but also in other countries as well. In many, many places, there were problems with official messaging reaching CALT communities. Translators take the blame. Well, let's see. In defense of translators, since I am one, you know, those posters with the mixed languages, that's not a translation problem. That's a workflow problem, a project management problem. Somebody had to go and test the translations before they went out. Don't blame it on the translators. You know? Many of the complaints applied to the way the English texts were written at the beginning without thinking of translation into multiple CALT communities and different levels of reading competence. There was, I may be wrong here, but it seemed to me, because I was looking for it, there was no standardized terminology for the multiple languages that people were going into. That is, at the beginning, if one had known how long this was going to last, one might have sat down and got standard terminology for the basic things having to do with COVID for all the states and territories of Australia. Didn't happen. Happened in some companies that I'm aware of, but I didn't see it happening on the level of a centralized policy or even state policy. A little bit of technology, standardized glossaries, translation memory software, might have solved a lot of problems. Then, time pressure is the enemy of perfection. Okay, we know this. But in this case, a late translation would be a failed translation. Better to have something, even if we're not sure of the terminology. And then the things that people were complaining about were precisely the items that are key to the code of ethics that we have: accuracy, completeness, impartiality. Okay, it's hard to read, but so is the English text. We do what's there. That's our job. Okay. And at the end of the day, the use of NAATI certified translators was the official policy, at least in Victoria. Here you have a succinct statement of the policy at the beginning of the COVID experience, and very clearly, translators and interpreters should be credentialed by NAATI. And interestingly, we have an outline of the situations in which access to professional interpreters and translators is required. That was a policy that was changed by practice. Now, what happened when these things came into the press was that the public perception of translation and interpreting went down. The public evaluation went down. I remember having a Twitter exchange with Mark Orlando when this first came out, and Mark saying, "Could this be Australia? What's happened here? You know, we have the best certification system in the world. Well, the most bureaucratic, at least. What is happening? Surely it's not like that." Surely it wasn't. People came to me from the press, that is radio, television, newspapers, asking, is it true? Is it true that there are mistakes in the translations? And I could say, yes, there are minor mistakes, because we did them in class in 7 languages. I have a translation class. We went over them. I could see things were not happy across the board. But they're not too bad either, to tell you the truth. And I had a peculiar ethical dilemma. If I recount the errors, that enhances distrust in translators, which enhances distrust in vaccination information, which is not working to the benefit of anybody. So should I then support my home team and say good things about translators? Well, as it was, I had a publication here. I tried to have a bet both ways, as they say, saying, yes, look, there are mistakes, but they're very minor. Mind you, the journalist who edited this text got rid of all the examples. Nobody's interested in linguistics, but anyway. But the important thing is trust, and that they've a trustworthiness, and that the translations are able to gain trust. And there are some rather negative comments there about using the code of ethics in these kinds of situations. But to tell you the truth, folks, it doesn't matter how subtle you try to be. Journalists will get the story they want to find. So we get things like this. It was a mess, Pym said. I don't think Pym said it was a mess, but anyway, okay, at least we got a linguistic example in this case. The press had its own way. And the stories of failed translations multiplied throughout this process, despite the best efforts of anybody like myself. And let me stress, SBS, which was supporting translators and interpreters all the way through. Now, I want to focus on that problem of trust. It's important to get trustworthiness, and I've just said there are 2 kinds, thin and thick. And I think it's important to realize that both have to work. Now, when I'm analyzing this, and this is where the academic bit comes, I'm sorry about it. Number 1, I don't trust anybody. All those things that the community leaders said in our report, none of them is to be taken as the absolute truth. With many grains of salt, as one says. Why? Well, obviously, they have an interest in criticizing official translations, because the more work they get done in their communities for the communication, the more subsidies they get from the government, and the more important they are within their communities. Sorry to have a Machiavellian reading, but there are grounds for doubting the absolute truth of what they say. I could do the same about translators, but this is easy. Any one text, if I've got 10 translators, I'll have 10 different translations, unless it's a mathematical theorem or something like that. Translators will all swear that their translation is the best of possible translations, but there is always uncertainty, therefore doubt, therefore no absolute truth. And I could say the same about researchers. We select the data to make it fit a certain narrative so that we can publish a result and get cited. Don't believe us either. It's the classical paradox. I'm lying. But all these things matter. The truth, don't ask me now, were there really translations? Were the translations really bad? Were these communities, it doesn't matter. Trust doesn't work like that. The representations of what was happening, the simulacra, as we would say with Baudrillard, the simulacra, the representations had a social force. What the press was saying worked in the community to create a certain reaction, a certain distrust. And trust, when you start to look at it like this, is not a linear thing. I trust this person, scientists, politicians, the press, the person in the street, and there's a linear trust process. No way. It's this rhizomatic or rhizomic relationship, like the roots underground where nodes beget more nodes, and there are multiple points of entry and multiple exit points as well. Trust is essentially complex and community-based. People trust the same way that the people around them trust, and people will trust a source of information if the people around them who are also trust that source of information. When you got that kind of complexity working, okay, the lies all matter. The lies all matter. It's not my role here to give you the truth of the translations or of whatever. What intrigues me is that the lack of absolute truth was effective and brought about a change in, I must say, translation practice. I don't know if it's policy, perhaps I shouldn't say that, but the community-based solutions came in. So when the government of Victoria decided to give a lot of money to solve the problem of translation and interpreting, most of it went to communities. And there have been a wave of open calls for funding projects. Very small part went to official professional translators and interpreters. Now, the solutions that brought were really good, I think. Some of them. This is so simple. It's poor technology, but very effective. People in their communities just talking about why they got vaccinated. Not in the community, sorry. These are medical staff at Royal Melbourne Hospital, and they're talking about what they do and why they got vaccinated. Let me see if I can just play this one.
रॉयल मेलबर्न हॉस्पिटल के एक कैंसर वार्ड में एक रजिस्टर्ड नर्स की तरह काम करती हूँ। मैं आपके साथ आज कोविड-19 के बारे में बात करना चाहती हूँ। आज हमारी स्टेट विक्टोरिया में 12,000 से ज्यादा एक्टिव केस हैं।
Okay, and so on. You can hear the traffic in the background. It's somebody just talking. It's somebody to whom people in that language community can relate as a person and as a professional. I'll go to the next one. It's all the website. You can go through and look at all the different language versions. They're all different because it's a person speaking in the first person, but they have 4 or 5 talking points. They all have to say the same things, okay? Now to my real problem. They win trust. They win thick trust. What's the long-term relation between those kinds of community mediators and professional translators who have the thin trust? And as you can see over here, I do pay attention to chat sessions at AUSIT events. And sometimes we're told here, community leaders are our main rivals. And they resent when to be an interpreter, you need testing and certification. All right. So do we resent them or do they resent us, etc.? Let me simplify the problem. Close community contacts enhances trustworthiness. And yet the role of governments in this kind of situation is to ensure equal access to services. So if you leave all the decision-making to each community, you have no way of ensuring that there is equal access. Some communities, organizations would work better than others. And so on a policy level, we will have to look for some kind of trade-off between trust as a positive value and equal access as a positive value. What would they look like? And that's the academic question I'm working on. And I don't have the answers. I'm just presenting the problem for you. Here are two clues about possible answers. And it's staring you in the face, folks. Here you've got the bikes, you've got the medical professional, you've got the traffic in the background. What do you have as well? These subtitles are very good. These were done by a professional translator and presented very well with the proper line breaks, etc. What's happening here? There's the thick trust communication, but a professional translator has entered here as well, allowing that process to be controlled so that some kind of tabs can be kept on not just what they're saying, but also to ensure that there is something like equal access becomes possible. So both are needed and both are indeed present. And then my second reflection, the way to close this, much of the debate that we're looking at there in that has translators over here and communities over here. But you and I know that the translators are also members of the communities, and that the professional translators have knowledge both of the communities and of the profession. And they should, I suggest, be doing more within the community-based activities. They should not be separated from it. The problem we have now is that there's a code of ethics that says translators and interpreters only translate and interpret. It's in the code of ethics. No side conversations, impartiality, etc. But if you look at history, translators and interpreters have always done more than translate and interpret. And I think that going forward, if we're going to find these trade-offs between these two values that are both good and have to be maintained at the same time, equal access and trust, we have to break down that code of ethics and get the translators, our particular community, working with others in these mediating communities to ensure that both kinds of trust are operative and both kinds of positive values can be achieved at the same time. There's the challenge for the future.